Thank you, Dr. Spector, for being with us today here in Austin.
Yeah, thank you.
To talk about your book, Gone in a
Joy, you
Heartbeat.
can always call me Neil.
Okay.
If that's easier, yeah.
Okay, thank you, Neil. So I just wanted to ask you, what are you doing here in Austin today?
Austin is, so I haven't been to Austin in years. I came here probably in the mid-'80s to take my medical boards when I did my residency at Parkland Hospital. So it was great when I was invited to give a keynote address at the meeting in Austin, which is the Cancer Prevention and Research Initiative of Texas, CPRIT. So this is a $3 billion fund that was set up by the state government of Texas, I think by Rick Perry, to try to find better prevention, cures, treatments, diagnostics for cancer. And I have been reviewing some of the grants, and so people thought that my story, which is both from a cancer research side and some of the successes that I've had in developing targeted therapies, and also as a patient. So the title of my talk is When Precision Medicine is Not So Precise, because this is the era of precision medicine, right? We use genomics to help guide, at least in cancer. We can talk about how that's lacking in Lyme disease. But at least in cancer, we use a lot of very cutting-edge technologies to try to profile people, profile the tumors, and then try to come up with the best therapy tailored to the individual. And we call that precision oncology. So I've been doing a lot of precision oncology over my career, and unfortunately, as we'll discuss, my story demonstrates how precision medicine often is less than precise.
Well, I'm so glad you're here today to talk about that and shed light on the cancer research, because you also have a lot to share. We get to interview you, and you can share your story about your book, Gone in a Heartbeat. And I want to ask you if you could tell us what inspired you to write this book, Gone in a Heartbeat, and what is it about?
What inspired me was, I thought that people would really benefit from this book. So, it'd be nice if I said, oh, my story inspired me. But it's a story at multiple levels. It's a love story. My wife and what she went through. The story centers on my 17-year struggle with Lyme disease, several years being misdiagnosed, and then the sequela, the long-term complications, the cardiac debilitating illness that followed. But the story really is about, how caregivers like Denise, my wife, who often who aren't recognized for what they do, really, her story inspired me. I thought that telling the story of perseverance and how people can overcome the most incredible odds would help other people get through whatever challenges they were facing, whether it's illness, financial, marital, you name it. We all have, challenges in our lives. And I also felt that, my story was somewhat unique in that I was a physician, or I am a physician scientist, and I literally fell through the cracks of the medical system. So, I'm the very person that you would think people would have figured it out, and yet I was dismissed for years. So I think from that perspective, I felt like my story needed to be told, because there's so many people out there who aren't heard and really dismissed. And I thought that, I at least have a platform. I've been in research, I've been in academics, and so hopefully my story would hold more credibility to those people who doubt that, that some of these diseases really exist.
Yes, tell us more about how you fell through the cracks. What happened? What were your symptoms, and when did you suspect something was wrong?
So my symptoms initially were not the classic symptoms for Lyme disease. I had cardiac arrhythmias. So I'll just sort of backtrack 1 minute in that I was incredibly healthy all my life. I've always been athletic. Before I got sick, I used to run 10 miles a day. I'd run Boston marathons. And so to go from really that model of health in a very short period of time to someone who could barely walk 10 yards without feeling just completely exhausted, and then having these episodes of rapid heartbeat for no apparent reason. I mean, I could be sitting, sleeping, doing virtually nothing, and all of a sudden my heart would start racing to 200, 250 beats a minute, and it would last anywhere from 30 seconds to a minute, and then just spontaneously resolve. And so, and I never remembered having a skin rash or being bitten by a tick. And so sort of fatigue, transient arrhythmias, and then an episode of brain fog, which many of the people who may be listening to this can relate to. But I describe this as similar to taking 50 milligrams of Benadryl every 2 hours for weeks at a time and just feeling like you're sort of walking through this cloud. Mind you, I mean, I was taking care of incredibly sick people, bone marrow transplant patients with leukemia and lymphoma. I had my research lab, and yet I just felt like I could, like I just couldn't see clearly or think clearly. And every time I went to a doctor, every time I went to an emergency room for these palpitations, they would have resolved, number one, by the time I'd get to the emergency room, and I'd be told the same sort of thing. You're stressed, you're writing grants, and there's nothing wrong with you. I'd have an ECG, I'd have blood work, and everything would come back. I mean, the routine blood work, your blood counts, your chemistries, your blood sugar, your sodium, your potassium, and everything would be normal, and they'd say, everything's normal, there's nothing wrong with you. And so that went on, and so...
How many years did that go on?
So that went on for over 4 years, and meanwhile the arrhythmias persisted, became more complex. So at times I went from having a very rapid heartbeat, again always transient, to having alternating very slow heart rates of 40, 50 beats a minute. Which is fine if you're an elite athlete, you're conditioned, you're running marathons. But at that point in my life, I was barely able to, like I said, walk 10, 15 yards without having to stop and just, it wasn't really shortness of breath. It was really feeling like I was completely exhausted, like I had no energy in my body, and every cell in my body was screaming for energy. And so, so I'd alternate between these rapid beats, slow beats. And again, every time I'd go see somebody, my heart rate would be normal, and same sort of thing. You're stressed. And, it's like when you take your car and you hear like a clinking and a clanging, and then you go to the mechanic and they drive it around and everything's fine, right? Like that's what would happen. Every time I'd get to see somebody, there'd be nothing wrong. And I had Holter monitors I wore, and they would never really capture anything. So, I was sent to psychiatrists, psychologists, and I did all they were great. I mean, I did biofeedback, wonderful. I learned to meditate, great. But it didn't really address the problems, and it didn't change the symptoms I was experiencing.
So how did you figure out it was Lyme?
So finally, after 4 years, and I knew it wasn't stress because I'd been stressed in my life. I mean, as I tell people, I had worked 130, 140 hours a week in the intensive care unit at Parkland Hospital, the old Parkland Hospital. And anyone who's familiar with Parkland in Dallas knows that it's a busy hospital, a lot of indigent patients, incredibly sick patients. Working 140 hours a week, sleep deprived. There's a lot of stress, and I had never experienced anything like what I was experiencing at the time that I had Lyme disease that was undiagnosed. So I knew all along, that it wasn't stress. Although, Joy, at some point you start to question yourself. Like if all these people are telling me it's stress, maybe it's stress. Maybe this is a weird manifestation of stress that I've just never experienced before. I never really thought that for long. I mean, I'd always come back to the fact that there was something physically wrong. And I knew that if I didn't get to the answer at some point that I'd be dead. I mean, I really felt like I was dying. And so finally, after 4 years, what happened is that I developed a persistently slow heart rate. So rather than sort of the intermittent slow heart rates that would then, resolve and I'd be back to normal rate, and then intermittent rapid heart rates and then resolve, I just developed a flat out slow heart rate of 40 something beats a minute. And I felt like I was living on low octane gas. I mean, I just felt like I'm going through the motions, but I just can't keep this up. And I was working. I was working full time again, very stressful, life. And then, so slow heart rate. I started having these bizarre episodes at night where I'd have these flashing explosions of white light that would wake me up from sleep. And then what really gave it away was, out of the blue, I developed, for the first time over the course of this mysterious illness, arthritis. I mean, just swollen joints, frank swollen joints, out of the blue. And I had been prescribed doxycycline for a completely independent reason. And within a short period of time, the arthritis resolved 100%. I mean, just went away. And so I started to, then it was like the light bulb went on, right? I mean, arthritis, responding to doxycycline, these weird cardiac manifestations, extreme fatigue, fibromyalgia-like pain, brain fog. And so this was 1997. So it wasn't like Lyme disease was a big deal then. I mean, it's certainly not like it is now. And I guess, the internet also wasn't like it is now, where you just jump on and start, but I did start researching, and it seemed like, I lived in New England, I used to run in the woods. It's got to be Lyme disease. Like, why would somebody without a history of heart disease, have these manifestations? I went to the doctor for the slow heart rate, and it turned out that I had, I'll never forget laying on the table, the tracing is coming off the machine. And nowadays, you don't really even need a cardiologist, because the computer in the machine gives you the answer to your report, and it said 3rd degree heart block. And so as I'm looking at the tracing coming off the machine, it's interesting, the first thought I had was, that can't be mine. That has to be someone else had their tracing stored, and this is just coming off, it was stored, no one printed it off. But yeah, sure enough, I mean, my heart rate of 40 made sense. I had 3rd degree heart block, which is, a classic manifestation of Lyme disease. So, and then I said, if it quacks and waddles, it's a duck and not a zebra.
But didn't you get tested for Lyme, and the doctor was telling you didn't have it? What happened with those tests?
So I got tested. So they were going to put a permanent pacemaker in. Mm-hmm. And all the blinding white light that I was having were pauses between heartbeats of 6 seconds, which is like an eternity when your brain gets no oxygen. So the exploding white light was literally lack of oxygen to the brain that would wake me up. I mean, thank God it was during sleep and not while I was driving on, I-95 in Dade County. I was living in Miami at the time, which made things even worse, because in Florida, like, no one, Lyme disease was like number 1,000 out of 100 on the list of potential diagnoses. So, so they were going to put a pacemaker. I said, let's hold off. I want my Lyme disease test. And sort of ironically, I said I wanted sent to a lab in the Northeast, a academic lab, because I thought that would be the best place to get tested. And certainly I didn't trust anyone in Miami knew how to test for Lyme disease. It was probably a big mistake to select the lab I selected. So I sent the lab off. They were waiting to put the pacemaker. Probably 4 days later, I get this call from the cardiologist saying, your test is negative. We're going to have to put a permanent pacemaker in. You don't have Lyme disease. Now, you know, my first inclination is, here's the head of cardiology telling me your test is negative. He must know the test is negative. I sent it to a lab that I thought was going to be a really good lab to give me the best result that I could possibly get. They're saying it's negative, it's negative. So I had the pacemaker put in. I had a defibrillator put in as well, what they call an AICD, because all the episodes of rapid heartbeat that I had had over the years, probably 1,000 or more, turned out to be ventricular tachycardia, which is a potentially fatal arrhythmia. And I was incredibly lucky that I didn't just drop dead on any number of occasions. So put the pacemaker defibrillator in. My cardiologist told me, Neil, you're going to feel great after this. You know, you could live with a pacemaker defibrillator. And a month later, when I went back to have my pacemaker checked, I said to him, I'm not feeling great. I still can barely walk. I still am having these episodes, the arrhythmias, and I don't feel right. And I had lost 20 pounds. I mean, a lot of things had happened that were just unexplained. And he said to me, you need to just get on with your life. He said, you know, denial is the most common reaction of someone your age when told they have heart disease. And I just thought, you gotta be kidding me. I'm your colleague. I was working in the same medical school. And here you're completely dismissing my concerns that that pacemaker defibrillator did not solve the problem. There's something going on. So I asked to see the result of the test. It was negative. And it turned out that the test really wasn't completely negative. So
Did you have some bands which bands were positive?
So my ELISA was sky high. I mean, it was just off the charts. And I had some I had an IgM band, but didn't have any IgG bands. So I started reading some of the controversies, although again, in the sort of the mid-90s, there wasn't the amount of awareness I think that there is now about the lousy testing. And I just said I want the test repeated, and I want it sent to a different lab. I eventually sent it to IGeneX, and I sent it to IGeneX because I went to a physician in New Jersey who said, I think we need to send it to this other lab. They also, by the way, sent it to Stony Brook Labs and IGeneX. And there were several bands on, the IgM was positive. There were several bands, although not 5 out of 10 on the IgG. And she said, you have Lyme disease and we need to treat it. And so I was treated. I had a PICC line put in. I had ceftriaxone for Rocephin. I had Rocephin for 3 months. Every day. I had some classic Herxheimer reactions right off the bat. First dose that I got had severe shaking, chills, low blood pressure. We thought it might be an anaphylactic reaction, but it turned out probably to be a Herxheimer reaction. And then I also got relatively high doses of Bioxin or clarithromycin. Now, at the time, there weren't tests for Bartonella, and people have asked me, maybe I had Bartonella, because I also had symptoms very Bartonella-like in retrospect, sort of the burning sensation on the heels of my feet so bad that I had to sleep with my legs propped up because I couldn't touch the heels to any surface. I just got these, incredible, painful, burning sensation. And so I've never really been tested for Bartonella. I know sort of the clarithromycin, some people believe may cover Bartonella. But I got that for 3 months. Almost all my symptoms resolved. So the fatigue got better. The burning sensation went away. Some of the night terrors that I had, and I tell people it wasn't like having just a bad nightmare. I mean, there were these really grotesque night terrors that are waking up screaming that, again, people have ascribed to, some people to Lyme disease, other people to Bartonella. That resolved. I gained back my weight, started exercising again. The one thing that didn't resolve was the cardiac issues. So they waited and waited to see whether the antibiotics would overcome the heart block, whether they could actually see the normal, intrinsic electrical rhythm in my heart, which never really returned. And then I found out that I also had muscle damage. So I had what's called cardiomyopathy, which is, not only the electrical system was literally shot in my heart, but then the muscle damage was so severe that in 1998 I was told at that time that I needed an emergent heart transplant, which thankfully I didn't at the time, needed. And then, lived an additional 12 years with a severely, severely damaged heart.
What capacity were you operating at?
So I tell people technically I had what they call a 15% ejection fraction. Now normal is 55% or more, and I was at 15%, which is, if you go to zero, you're not giving an interview. So, so it was 15% was pretty bad. It was amazing that I was not only alive, but that I was exercising, probably more than most people with normal hearts. So I decided that in addition to taking medication and some supplements, that the one thing that I could do for myself was to exercise. And 5-6 days a week, I would get on the elliptical, exercise for an hour, work out, really hard. And I worked full-time, traveled the world, developed 2 cancer drugs, got defibrillated several times along the way, which I wouldn't wish on my worst enemy, coached my daughter's soccer teams, and really lived the life that I wanted to live. I mean, the one thing that I decided very early on was that I could either roll over and do woe's me and play the victim and why did this happen to me? I lived a good life. I never smoked. I did all the right things. Or I could just live my life day to day, be as productive, enjoy my life, realizing that no one has any guarantees for tomorrow. And maybe my guarantee just seemed a little, less certain than other people. But the reality is that we all, we don't know what's going on. And so you just live each day to its moment to the fullest that we can. And that's really how I tried to live my life. I mean, I'm not going to say that it was perfect all the time and that there weren't moments when I did fall back into a woe's me, but they were pretty few and far between. And, I tell people that I had some of the best teachers in the world to get me through that. And my cancer patients, I mean, I've been taking care of people with cancer for years, and I just seen incredible acts of courage of people who overcame the odds, or even people who died of their cancer, but who lived incredibly productive lives, meaningful lives, for as long as they lived. And I just decided that whether I lived 5 weeks or 5 years or 50 years, that I was not going to look back with any regrets and not look back thinking, wow, I wasted my life blaming and feeling sorry for myself instead of, witnessing the beauty of life, my daughter growing up and all the other things that thankfully I've been able to, accomplish. So, so it really was a matter of just persevering and living by the adage that we're much more than what our body's telling us. I mean, we're not just skin and bones and calcium and minerals. I mean, we are sort of a soul inside this body. And I had seen that all along, as I mentioned, in my cancer patients whose bodies were decaying, but whose the beauty of their soul just, really shined through, and you could tell that there was, that they weren't, who they were was not what was becoming, was not what was happening in their body. And so I used to do this exercise every once in a while. I would stare in the mirror. I mean, literally, I would just stare in the mirror. And there were times I swore that I could see somebody looking back at me. And I knew it wasn't, Neil Spector with cardiomyopathy. You know how the medical profession can label, you as your disease. I mean, when you make rounds sometimes and people say, oh, that's Mrs. Jones with breast cancer and liver mets. And, well, it's not Mrs. Jones with breast cancer and liver mets. It's Mrs. Jones who's got 3 kids and likes to, write poetry and loves to travel. I mean, that's really the person. The cancer is not the person. And so when I'd look in the mirror, I would realize that there's somebody in there that's not cardiomyopathy, not Lyme disease, not, chronic pain that I might have been experiencing. And that really bolstered, I knew that, there was more to me than this disease. And that my mission was to, again, just live as productive a life day to day as I could without any regrets. So that's the way I approach my life. I mean, I knew that at any moment I could drop dead. And if that happened, I just wanted to make sure that, that I had no regrets for how I lived my life.
And you have succeeded in being very productive with your work.
Thank you, yeah.
And also with your family. I know there's lots of love there for your wife and daughter. And before we move on, why don't you tell us, what is it like having a pacemaker that defibrillates you? Can you share one experience about what happened with your heart? Even though you
Sure.
had gotten all these antibiotics,
Right.
and you were being so productive and you were exercising, what was happening with your heart every now and then?
So every now and then, and often it was when I, to be honest, wasn't taking care of myself. So, cutting the lawn in 104-degree heat and not hydrating sufficiently. So 2 things would happen. The pacemaker would either, before it would shock me, it might trigger what's called, there's a program where it would try to speed up my heart, which may not make sense. So let's say my heart would start racing at 200 beats a minute. And Joy, this all happened in seconds, because if it didn't happen in seconds, I would either be, in a hospital.
It's your phone, I think.
Amber alert.
That's what it is. It's either that or there's a weather alert in Durham somewhere.
Mm-hmm. But here we are in Austin.
Yeah.
I'm going to try a different angle.
Okay.
Okay.
So it would either try to they call it override pacing.
Mm-hmm.
So again, it seemed like hours that this would all take place, but literally it was seconds. So what I would feel is, I would feel like a flutter. I'd feel like the beginning of a rapid heart rate. And then the pacemaker would sense that, and the pacemaker would try to double the heart rate, let's say. So in a burst, my heart rate would really go from 200 to 300, again, all in seconds. The 300 was from the pacemaker. And it would literally try to outpace the arrhythmia and try to terminate it. If that didn't work, and that happened thousands of times over the 12 years, I mean, thankfully I wasn't shocked thousands of times, or I'd be on some pretty heavy-duty antipsychotics at this point. If that didn't work, then I would get shocked. The first time I got shocked, I'll never forget, I was in the airport in Newark, New Jersey, coming back from visiting this Lyme disease physician. And I was trying to make my flight back to Florida, and I was running a little late. And again, I was just so physically debilitated and fatigued. I certainly wasn't running down the terminal. And I'm carrying these big jugs of urine to try to collect for Lyme antigens at the time. And all of a sudden, I felt this sick feeling. So here I am surrounded by all these people in a busy terminal in Newark Airport. And I heard this buzzing in my ear. Turns out the buzzing was the defibrillator charging. You ever see the shows where they say, okay, everyone clear, turn the thing on? And the defibrillator, charges, and then you deliver the shock. Except this is inside your body. So I actually heard the buzzing of the defibrillator charging, getting ready to shock me. And then literally the next second, I was like flat on my back. And I felt this incredible, I describe it as if like a heavyweight boxer hauled off and punched me in my chest as hard as they could and just completely flattened me. I heard this big explosion. And I thought that everyone around me had to have heard that explosion, right? Because in my mind, it was this crunch, explosion, flat on my back. Well, of course, no one heard it. And people are looking at me, probably thinking, this guy must have had too much to drink, in the lounge. Relatively young guy at the time. All of a sudden, he's walking. Next minute, he's flat on his back. And so it turned out there was a nurse who was sitting, I mean, this is like karma, I guess, who was in the Oban pond sitting there watching. And she ran over, she said, "I'm an ICU nurse. Did you just get defibrillated?" I said, "Yeah." So that was the first time. And then I got shocked. I managed to get on the plane, got off the airport, felt that buzzing again as soon as I got to where the ticket, when you walk off the connector to the plane, felt that, knew what was coming, sat down, braced myself, and got shocked again. And then, they called 911 and ended up in the emergency room. And I was shocked once in our neighborhood swimming pool 3 times in a row in front of my daughter, which was just a pure nightmare. It was like boom, boom, boom 3 times, just praying to God that either just take me because I can't tolerate this anymore, or let me live. And then, my lips were purple from lack of oxygen. Just every time I would get shocked, I would have this release of adrenaline. So I'd literally be having Rigers, like teeth chattering shakes from all the, just the trauma in you can imagine, this is like getting electrocuted inside your body. So every cell in your body, which was never meant to experience this, is reacting to getting jolted by an electric shock. And so I would literally just be chattering, and that was terrible. Actually, my wife felt the shock because they were trying to get me out of the pool, and the water transmits electricity, and so she got shocked, and our neighbor got shocked, and really felt not the full jolt, but thankfully managed to get me out of the pool before I got hit 3 times in a row.
So dramatic.
It's terrible. I mean, it gives me a PTSD moment just thinking about it.
Yeah, well, yeah, it sounds horrible. What happened? You had that happen several times, and you went for 12 years with this minimal functioning heart. And
right.
Then what happened that you had to have a heart transplant?
So what happened was, in 2008, I started to go downhill. Because what happened initially was, even though I had severely damaged heart and poor heart function, the size of my heart was normal. And so the size could compensate for the poor function. And probably all the running that I had done for years got me through. I mean, thank God I had been a runner and maintained my health. Otherwise, I probably would have gone downhill really fast. And so whatever 15%, whatever healthy heart muscle was there was keeping me going because, again, I was working full-time, traveling, exercising. But eventually my heart started to dilate. And once it dilates, I make the analogy, it's kind of like if you take a hose outside and you block off one end, and as the hose starts to get bigger and bigger, the lining of the hose thins and thins, and eventually it'll burst. And so my heart started to dilate and get bigger and bigger and bigger, and the muscle part of the heart started to thin and thin. And as that happened, I was less able to compensate for the 15% ejection fraction. And I started to notice like I couldn't walk up the same hill that I used to. I'd have to stop, and I used to sort of play this game, like I would stop and say, "Oh, I think I need to make a phone call." I mean, I knew that something was changing, but I would just make an excuse. I need to call my wife, so I would stop halfway up the hill and call her. And then 2 months later, I had to stop twice, and then 3 times. And it was just clear that I was, not going to function much longer in that state. And then there was an incident that really tipped me over the edge, where they thought that I had an infection in the pacemaker. I had an area that, I mean, I had multiple pacemaker batteries put in. I mean, my chest wall looks like some, excuse me, some road map with scars. And one of the scars opened up. And if you have an infection that communicates from your skin directly to your heart, that could be fatal. So they put me in the hospital. They were going to put a PICC line in to give me intravenous antibiotics. And it was supposed to just be what they call a 23-hour stay, because they couldn't put the PICC line in that afternoon. They were putting me in overnight. They were going to do it first thing in the morning, send me home. Anyway, I go in the hospital. My wife was with my daughter at the time at an elementary school trip at the North Carolina Zoo. And I remember calling her and saying, I'm just going in overnight. It's no big deal. They want to give me antibiotics through a PICC line. I'll be home in the morning. Don't even come in to see me, because there's no reason to. I'm fine. So 4 in the morning, I notice, I wake up, there's a commotion. There's nurses, there's doctors around, residents, because I'm in a teaching hospital, looking at my monitor. And I look at the monitor, and I'm in a slow ventricular tachycardia, right? But it's slow enough that the defibrillator doesn't sense it as being abnormal. So nothing's happening. I'm not getting shocked. I'm not getting that override pacing, because it's just below the threshold for what the pacemaker views as being abnormal. And so this is an instance where I actually told the physicians on call that night, 4 in the morning, and I'm wide awake, mentally intact, normal blood pressure. I said, go get the programmer, because now defibrillators, pacemakers, it's all done externally. They have like a computerized way of programming them. I mean, I'll go into your heart every time and reprogram them. I said, just get the reprogrammer, lower the threshold so that the device sees the arrhythmia as being abnormal. And this had happened once before, several months before. And I said it'll take care of the problem. And I'm a doctor, right? I'm giving them the cheat sheet. Just do what I'm telling you. Rather than doing that, they gave me a medication that probably 9 out of 10 times would have been fine, except that I was the one time that it wasn't. And literally within seconds of getting the medicine, I told them I had this sick burning sensation, and I said, I think I'm dying. And the last thing I remember was they were taking the bed and they were saying, let's get him to the ICU quickly. They called my wife at 4, so here I had called her that evening and said, don't even bother coming in, because I'm going to be home in the morning. It's no big deal. And they told her, and she's in the medical profession, she's a nurse, they said, you need to get in ASAP. So that generally means your loved one is dying, and you need to get here before they die. So she came in 4 in the morning. The team of physicians is pacing. I am completely out of it. They have me in what's called Trendelenburg position, because I had no blood pressure, where they put your legs up in the air. They tilt the bed up to try to get as much blood flowing to your brain. I think I'd had a seizure from low oxygen to the brain, because I had bitten my tongue and had some scratch marks, probably from where I had a seizure. And then about 10 in the morning, I just somehow opened my eyes, and my wife was sitting there, and I just thought, what are you doing here? Like, why are you here? And then she told me the whole story of what had happened. And that episode really tipped me over. I mean, because I had severely damaged heart, and then several hours of virtually no blood pressure was sort of the straw that broke the camel's back. And so after that, so that was June of 2009, I went home, and I started having ventricular tachycardia 20 times a day, just sitting there, boom, 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 nothing, no rhyme or reason, because my heart was just so damaged that the muscle was just reacting. And so, I'd have the anti-tachycardia pacing, I'd get shocked. I mean, I knew I couldn't go on like that. So they brought me, and then I started to develop towards the end of June the first evidence of heart failure that I'd ever had, the first swelling. I remember I came out of the shower one day and I thought, that's kind of weird. I've got like this little gut. It looked like a beer gut, which I'd never had a beer gut. But I thought, like, where did that come from? And then the next day it got bigger and then my feet swelled. And I mean, they were huge. I couldn't even put slippers on. And then I started swelling in my abdomen from fluid accumulating because my heart just couldn't pump efficiently. And so I looked like I was about 6 months pregnant. I couldn't sleep at night because I couldn't breathe. There was fluid accumulating in my lungs. And they'd bring me in and out of the hospital over a few days and try to get the fluid off, and my kidneys were failing, and my liver was failing. I mean, I essentially was dying. I mean, organ after organ was shutting down. And there was a moment that I describe in my book where I was ready to end it all. I mean, it was a nightmarish ending. I mean, the one thing that I'd always thought was, I could live with this, but I can't die a painful death. And I can't have my family see me die a painful death. So, so I got to the point one night where I just asked my wife to end it all. Thankfully, she didn't. I mean, actually, I don't even think I'm sure she paid attention to what I was saying, but she really didn't respond. I mean, she knew that I was going to need a transplant. I mean, she knew I was going to need a transplant years before I had come to that conclusion. I mean, I had gone, even at that point, to the very end, where it was very clear I needed a transplant. Somehow I thought someone would come running in the room with a vial and say, oh, we've got the discovery, we could regrow your tissue, or we just grew your little, your cloned heart, here it is, we're going to put it in. I mean, I really thought that there were people, because that was my life, right? I was working on trying to cure cancer and have that little, aha moment for those people with breast cancer and other cancers. And so I just thought there's got to be somebody out there working on this for me and so many other me's with damaged hearts. But that wasn't to be. And, it came to the point where I was given 72 hours to live.
What did the doctor tell you when you finally went to the hospital and you realized you were going into heart failure? And you went to the hospital?
Yeah.
What did he say to you?
So I'd never met the transplant surgeon before. And here I was, literally, I mean, I knew that things were shutting down. My body was dying. And he said to me, do you want me to sugarcoat this or just tell it like it is? So I've been around surgeons long enough, and I said, just tell it like it is. And this was a Friday afternoon. He said, you're going to be dead by Monday without a transplant. Or they had this big refrigerator unit that was one of those mechanical pumps. It wasn't like the nice ones that you see, Dick Cheney wore one and other people where you can go play golf, because both sides, right and left of my heart, were severely damaged, as opposed to just one side, where I could have had what they call an LVAD. So I would have been tethered to this refrigerator unit in an ICU, unable to barely move, because I would have had to have remained still in bed. They put a big catheter in your groin, and you can't move beyond a certain degree, so you're literally just lying there. So he said, yeah, you're going to be dead by Monday. You need to let me take control. That's an interesting story, because he said that. I'm not like an organized religious person. I mean, I'm very spiritual, but it's not like I go to any religious service on a regular basis. But he said to me, I'll never forget that, he said, you need to give up the control. Because he thought that I was trying to maintain control over my own care, like, have you given me this drug, or given me, I was like acting like a typical physician. And so when he said that, it sort of clicked in what he meant. I mean, not what he meant, but what I needed to do, which was just to let go. I mean, you know that classic let go and let, if you believe in God or whatever, let some higher being take over. That's what I just said. I have done all that I could do. I've lived the life that got me to this point. It's up to you. Whoever's out there, you're either going to let me live or I'm not going to live. And so it's a funny thing, Joy. You know, at that moment, it was like the most peaceful moment of my life. And people say it, and I tell people that all the time, and I write about it. It was just so, it was like pure bliss. I mean, after he said that to me, I just put my head back, put my headphones on, and it's kind of funny, I was listening, my sister-in-law had sent me a CD of these religious, sort of rock religious, I guess, sort of rock Christian. Again, I'm not a religious person, but I happen to like the song "The Healing Rain" by Michael Smith. I don't know if you've ever heard of that. No, that's good. It's a good song. Anyway, so I just put my headphones on, I laid back, and I just had this like incredible smile. I think the surgeon thought I was crazy, and they put a life-saving, they called it an aortic balloon pump. It literally is like this umbrella that opens up in your aorta that takes the pressure off a failing heart. And then they transferred me to Duke, which has a huge heart transplant program. And 36 hours later, I was in surgery. And 12 hours later, I was out, yeah.
And you got a new heart.
Yeah, and 24 hours after being out of the ICU, I was walking 3 miles around the halls. The nurses were telling me, you need to take it easy. You didn't just have your tonsils out, you had a transplant. I just thought, wow, this feels so good. I mean, this, you know, for the first time in years, literally, I had no pacemaker, no defibrillator, and just a strong, functioning heart. And I couldn't believe, like, wow, I gotta get out there and walk.
Like day and night. Who was your donor?
So my donor, so I have a female heart, which I always tell people I get a little more emotional than I've always been an emotional person, but now it's kind of, amped up a little higher. I don't really know much about her. We exchanged, the family and I exchanged a letter. There's, I don't know whether this is a national rule, but in North Carolina, the organ donation center, there has to be 2 amicable exchanges that are anonymous. And they're edited, so I can't say, gee, I work here and I do this. I did say some of that, but you can't really say who you are or give any identifier, and neither can they. So we communicated once, and you have to wait for a year after your transplant. And it was, back in the days when, when you got your college acceptance through the mail as opposed to now, by email or some funny YouTube thing, and you'd go to the mailbox every day looking for your college acceptance. So I did the same thing for months and months. I mean, when is that letter going to arrive from the family? And then one day I went to the mailbox, I got this letter that just didn't look like any letter. I didn't quite get the address. And so it was, 6 months later I got a letter from my donor's family. And yeah, it was a beautiful letter. Very, I told her husband and the family that, that I'd spend my life saving other people. I found it ironic that I had given the gift of life, that I had done bone marrow transplants, and many of them were donor allogeneic transplants where we would take a relative or a stranger's bone marrow and give it to that patient with leukemia or lymphoma. So I had prided myself on giving the gift of life to others. And here I found myself on the receiving end, sort of a strange karmic universe. And I just said, that I had dedicated my life to helping people through my research, through my, through other things that I'd done, volunteering work, and that, their loved one was now living on with me through my work. And, and that I considered what they had done, giving me and giving others, liver, pancreas, organs, life-saving organs, to be the greatest act of love that anyone could give to another person, especially a stranger, and especially in the midst of their own grief. I mean, it was a very strange feeling that we were celebrating while somebody else was grieving. So, still difficult sometimes to come to terms with that. But the one thing, the story that I'll tell you that was in the letter that I sent, I mentioned that my daughter, who at the time was 11, wanted to name the heart. Like, we couldn't just say, oh, Daddy's new heart. And so she came up with the name Heavenly Precious. So I wrote that letter to the family. And at the end of the letter, after the husband said how moved he was by the work I had done, and how, that his wife was very spiritual and religious, and, and she would have loved to have met me, and, and now she's a part of me, that he said that the thing that moved me the most was what your daughter named the heart, because he said, I named my wife Precious. Her name was Vicky, but he said I called her Precious. And he just said that he felt that that was his wife communicating through my daughter to him, that everything was fine, and that his Precious's Heavenly Precious was now beating in my chest. So I thought that that was just an amazing thing. I mean, I don't find that to be a coincidence, but
Yeah, that's beautiful.
yeah, it was pretty
Beautiful
amazing. Yeah.
So now that you have Heavenly Precious in
Right.
your heart, how are you feeling, and how's your life, and what's different now?
I feel great, probably a little overworked. I have to admit that laying in bed, waiting for that heart, and afterwards, I made lots of promises to myself that I would never be stressed by the sorts of things that used to bother me. I would never let my work-life balance get out of balance. And for a while, I kept pretty, I lived up to all those promises that I made, and then, then life somehow drags you back into worrying about the things that you said you'd never worry about, and, your job kind of taking more out of your life than you said you would let it. So I need to always take a step back and say, you know what, these things aren't that important. Remember where you were, now coming up on 9 years. So I exercise. I've run several half marathons. I run regularly. I just ran the other day 8 miles. I meditate. I've always eaten right, but I still eat right. And I'm just very cognizant of the gift that I've been given. And I try to, where I can, tell my story. In my practice with cancer patients, I've come across people who have had bone marrow or stem cell transplants, some of whom are on the same medicines that I'm on for anti-rejection. And so when they tell me, oh, Neil, I'm having these symptoms, and I tell them, no, it's okay, you're going to get there. And then I tell them my story, and they look at me as if, you got to be kidding me, you had a heart transplant? I mean, you look great. And I tell them, yeah, well, you're going to be the same way in a few months. If, a year, you'll be, where I am today. So I feel like I have the street credibility, so before I had a lot of compassion. I guess now I can have that empathy because I've been there. And so it's really a gift. I spend a lot of time with the Lyme disease community. We're doing research now. We got a huge grant. So we still do a little cancer research, but we're doing a lot of Lyme disease work now.
That's what I was going to ask you.
Yeah, it's very exciting.
Yeah, what exactly is your research on these days with Lyme?
Well, so, I've been very fortunate on the cancer side to have developed 2 targeted therapies, 2 what they call molecularly targeted therapies. And so about 2 years ago, I said to a friend and a colleague of mine at Duke, why can't we develop smart drugs for Lyme disease and co-infections? Why do we have to rely on antibiotics, that destroy your normal microbiome, that have all sorts of side effects, and that these bugs become resistant to ultimately? I said, why can't we do what we did in oncology, which was to try to get away from chemotherapy and get into smart drugs, that target the tumor cells to the exclusion of the rest of the body, or that activate the immune system, which is now the big transformative treatment for cancer. Why hasn't anyone done that in Lyme disease or Bartonella or Babesia? And so we said, why not? Let's do it. And so we applied for a large grant. We got the grant, and we've already identified 2 targets that look like they're unique to Borrelia, and we'll start to do the same with Bartonella. And in a month, we've only been funded for a month, we're already at the point where we're going to start screening for compounds. And then we'll try to develop a whole cocktail of targeted therapies that we hope will transform the treatment of Lyme disease and Bartonella. We're starting with the 2, Lyme disease and Bartonella, but this could easily expand to other co-infections and, frankly, other infectious diseases. And this would really be a transformative way of treating these infectious diseases. Rather than giving antibiotic therapy, we want to develop very targeted smart drugs that avoid the normal gut flora and really target these, Borrelia and Bartonella.
That's awesome. That's so exciting.
It's very exciting. I'm
Yeah.
telling you, it's very exciting. And we're now, thinking about the immunotherapies as well. Can we activate the immune system? For decades, the holy grail of cancer therapy is, why doesn't the immune system recognize a tumor and destroy it? And we know now that the tumor cells have figured out a way to evade the immune system and essentially even just shut off the immune system to the tumor cells. And we think that Borrelia, the bacteria that causes Lyme disease, and probably Bartonella are doing the same thing the cancer cells are doing. So if we can now turn on the immune system to eradicate cancer cells, why can't we do the same thing for these infections? Wouldn't that be great if there was a way just to activate your immune system to do what it should be doing all along?
That's the answer.
That is
That's
the answer.
Exciting.
Yeah.
We'll stay tuned.
Stay tuned.
The
Yeah.
results of your research. That's very exciting. Well, to summarize, what do you think is the most important thing for doctors to know in treating their patients and for patients to know?
I think doctors need to recognize this is a real disease. And I'm talking about, so everyone talks about folks who come in with a rash, the classic rash, like the Target, at the store. That's not the classic presentation. Most people don't have that classic rash. And it could come, some people don't have any rash. Some people may have a rash under their scalp, under the hairline. So you may not see it. Some people may have something that may look like a hive. And in retrospect, I had a weird skin rash way back when I first got sick that my doctor just thought was contact dermatitis, just thought maybe I had a new, belt right along the waistline. Maybe that was it. So don't look for the classic signs and symptoms that you're taught in some book. The real world is that people manifest with all sorts of symptoms. This is, we used to call syphilis the great masquerader because it could present as anything. Now Lyme disease is the great masquerader, the great imitator. That's what people are calling it. It can manifest as any type of symptoms you could think about. So when someone comes in with bizarre symptoms, especially someone, who's at risk, who's outdoors, who, may live in an endemic area, although endemic areas now are spreading. This isn't just a New England, Middle Atlantic, Northern Plains disease. This is Texas, Florida, Georgia, Arizona, it's all over. Think about Lyme disease. Think in the back of your head, what could be causing this bizarre constellation? How can I put all these weird symptoms under the umbrella of one disease? Think Lyme disease. So that's number one. Number two is the testing's not good. So there are states that have passed legislation that when doctors tell patients that they're going to order Lyme tests, that they're obligated to then tell the patient that a negative test doesn't mean they don't have the disease. That's how bad the tests are. Like how many tests, if you got a pregnancy test and your doctor said, Joy, a negative test doesn't mean you're not pregnant. I mean, it'd be kind of a weird test. Like you'd say, well, how good is this test then? But yet we have a test that a doctor should be obligated to say, this test is so bad that it doesn't mean that a negative test doesn't mean you don't have the disease. So don't view the test as the Holy Grail. If clinically your inclination is this person has Lyme disease, then you're a doctor. Use your clinical judgment and your clinical skills and don't rely on a black and white test that is far from perfect. Second, people develop resistance to this disease. So this notion that, that 4 weeks of doxycycline is sufficient, I mean, we know from studies from, top universities, Johns Hopkins and others, that bacteria in petri dishes become resistant. Now, I'll tell you the truth. If you can't kill bacteria in a petri dish, think about it in a human being. I mean, we're much more complex than a petri dish. So if bugs become resistant in a petri dish, they're becoming resistant in humans. We know from studies in animals that you could treat aggressively and the Borrelia and Lyme disease persists. So this idea that chronic Lyme disease does not exist, I think is a mistake. Now, the caveat to that is, I don't know that everyone who has chronic symptoms has active infection. First of all, the other message is when you get bit by a tick, you may not just get one disease. So ticks are dirty vectors. You may get 15 different things, and we may only have tests for 5 of them. So people who don't get better, it may not be from Lyme disease. They may have successfully treated the Lyme disease. They may have Bartonella. They may have anaplasma. They may have God knows what. So take people seriously. Don't say it's all in your head or you're stressed or just get on with your life. I mean, we all know people who've been successful lawyers and physicians and bankers and high school students, straight A students, who are now on disability, who are out of school. To treat them as if they willfully wanted that type of life, I think is ludicrous. I mean, I've seen people who never missed a day of work in their life. They got sick. They could tell you the day they got sick, and now they're completely disabled. Now, as a physician, I don't have to have an MD to think there's something wrong with that person, and it's probably not in their head. Or if it's in their head, it's a bacteria in their head. It's not a psychiatric problem. So listen to your patients. Take the time and listen. That's my advice to doctors. For patients, be your own advocate. This is a highly complicated medical system that will order tests and you'll get lost in the system very quickly. So if you're not advocating for yourself or you don't have someone who's advocating for you, then you're in big trouble. If what you're hearing doesn't sit right with you, and I'm not saying deny. I mean, when somebody said to me, you need a defibrillator pacemaker, I didn't say, well, I don't think I need that. I put it in. But when I didn't feel better, I knew that there was something wrong. I didn't stop. And when that first test came back saying, it's a negative for Lyme disease, I didn't stop there. So as patients, we need to not abdicate control over our lives. You may have the best doctor, you may love your doctor, they may have great credentials, they may be from Stanford, Harvard, Yale, wherever. You know what? The only person who really cares about you is you. So do not give control over your life to somebody else. Healing is a team effort. It's a physician who's compassionate and listens and works with you, and it's you taking control over your life. It's not a physician telling you this is what you'll do. It's the two of you working together. That's how people heal. So I would say be an active participant. If you're not active in your own health and if you're not looking out after yourself, no one else is. So be an advocate, fight for your life, do not give control up to somebody else.
Great advice. Also, is there an organization that you would recommend for physicians to get better educated about Lyme?
So I think that I think ILADS is a good organization. They've got great learning material, ILADS, International Lyme and Associated Disease Society. So they've got guidelines. For those who may not know, there are really two groups. There's the Infectious Disease Society of America, which are your card-carrying infectious disease members who, are at most academic centers, actually even in the community, but they're board certified and they're part of this organization. Now, it just so happens that that organization has taken a very hard line on, number one, the criteria for diagnosing Lyme disease, and number two, for what constitutes successful treatment of Lyme disease. I don't particularly agree with their guidelines. Doesn't mean some of them aren't well-intentioned people. It just means that I think that their science is wrong and not founded actually on good science. ILADS, on the other hand, is the other organization, which I think is comprised mostly of real-world physicians who are seeing people not in some ivory tower, not at Harvard or Yale, who are, seeing tertiary care, but who are actually seeing people, in suburban Texas or rural Texas, who are taking care of the majority of people coming in with these diseases. They have different guidelines, ILADS. I think those guidelines are more realistic. I think they recognize that testing is imperfect. I think they recognize that we're not all robots and that not everyone's bodies respond, and not everyone's body's immune systems respond, and so you don't get the same, nice blood tests that the other organization believes that you need and you must have in order to make a diagnosis. So I personally think that if you want to learn more about the disease and some guidelines, I think looking at ILADS and going on ilads.org is a good way to do it. Are there physicians out there who are taking advantage of sick people? Absolutely. There are people who I think are doing things that are unethical and making money off of people who are desperate to get better. It doesn't mean, though, that we should, not accept guidelines. So there's criticism from one organization that ILADS physicians are overtreated in treating chronic conditions. I think, Joy, what we need is a better understanding of why people aren't getting better. Right now, really the only tools that we have are antibiotics to help people. You and I probably know lots of people who have benefited from antibiotics. You and I probably know lots of people who haven't. I think there are other options that, medicinal herbs. Nature has created its own antidotes to bacterial infections. It's been around for millions, hundreds of millions, billions of years. Most of the medicines that we prescribe came from medicinal herbs. It's just some drug company figured out how to make a more potent, expensive version. So when people say, what do you think? I wish I knew more about medicinal herbs. But I think there's something to it. I think nature has a way of treating, plants don't get some of these infections. They've created defense mechanisms.
I agree, and I think a lot of the ILADS doctors are looking, some people do well with antibiotics, and a lot of these doctors are also looking at these herbs now and looking at alternative treatments, complementary treatments that are working for people. So, but like as you said, no one answer for each person. Everyone is unique in terms of how they respond to treatment.
So it's really, it really is the art of medicine. I mean, people, look, I've grown up in a scientific laboratory where the scientific method of randomized, prove it beyond a reasonable doubt, rules the day. I've published in the top research journals. I've developed 2 cancers. I mean, I've lived the life of hardcore scientific hypothesis-driven research. There's so many unknowns that we don't know about. In medicine, is not, medicine is dealing with a human being, a complex human being that's not a mouse, it's not a petri dish. And so as much as we would like to make medicine an exact science with genomics and all sorts of, big data, it still comes down to a physician and a patient and taking the information that we have at hand, which often is imperfect and has lots of holes, but trying to do the best we can. A quote from, there's I think a physician philosopher at the turn of the 20th century, Dr. Osler, who was one of the early Johns Hopkins clinicians, said, medicine is the science of uncertainty and the art of probability. And that's really what it is. You take the information in, you look at that person, and it's the art of probability. What does that person likely have? So I think that you're right. This is not cookie cutter medicine. Some people respond to antibiotics, some people don't. Some people respond to antibiotics and supplements. Some people respond to supplements. It really is a case by case. And so I sometimes cringe, even on the Lyme disease advocate side, when people say, well, this is how you have to do it, because no, it's not. There's no one-size-fits-all formula for this. It's very individualized. I think the physicians who are the really good physicians have that feel for that patient and that feel for how to treat that patient individually and in a personalized way, and don't necessarily just do algorithmic medicine. And so that's, in a sense, it's a bit scary as a patient when you really have to live by the buyer beware rule. You have to go, you have to figure out, you may have to go to 5 physicians before you feel comfortable with the one that you want to ultimately go with, whether they're complementary or antibiotic based.
Mm-hmm.
So it's, it's a journey. We're all on the journey, right?
All on the journey, and like you said, you ultimately have to trust your gut and follow your inner guidance and your inner voice as to what is right for you.
Right.
In conjunction with your healthcare provider, but as a patient, you really need to listen within for what's right for you.
Right.
And also, let's talk about your book, Gone in a Heartbeat. They're going to show
Yeah.
everyone your book.
Do you want me
They
to,
see
you want me
the
to
cover.
pick it up? Or?
Yeah.
And